HIV and AIDS PowerPoint. What are HIV and AIDS? A serious viral disease that destroys the body's immune systems. HIV and AIDS. HIV and AIDS, which were only discovered in the early 1980s, have already killed millions of people and millions more are currently infected. Things in this PowerPoint you're going to see are HIV and AIDS, are they the same thing? What are HIV and AIDS? Where did HIV come from? How is HIV spread? What are the effects of AIDS on the body? And how are HIV and AIDS treated? Are HIV and AIDS the same thing? Well, the answer is no. HIV and AIDS are different, but they are closely linked to each other. AIDS is acquired immune deficiency syndrome. It is a serious viral disease that destroys the body's immune system. AIDS is caused by a virus called human immunodeficiency virus, also HIV. Remember that HIV is a virus and that AIDS is a disease that results from an infection by the HIV virus. A person can be infected with HIV and not be suffering from AIDS. Where did AIDS come from? Although nobody knows for sure, most scientists think that HIV came from Central Africa, where African green monkeys live. These monkeys have been known to be infected with simian immunodeficiency virus, SIV, which is very similar to HIV. It is said that the SIV particles changed slightly to become HIV and somehow contaminated the blood of a hunter while he was slaughtering a monkey for food. Recent studies of the blood sample taken in Africa in 1959 have revealed that the first known case of HIV. In 1981, the first case of HIV and AIDS began to appear outside Africa. HIV and AIDS is now a global problem. How do you spread AIDS and HIV? 1. Sexual contact. This is the most common way that HIV and AIDS are spread from person to person. 2. Sharing hypodermic needles. When needles are used to inject drugs, blood can remain on the needle and be passed to the next person who uses it. 3. Blood transfusion. This is a form of transmission is now rare in this country thanks to those testing the blood supply. 4. Mother to child HIV can be transmitted from a mother to her unborn child through breast milk. Because of new drug treatments, these types of transmissions are also rare in this country. What are the effects of AIDS on the body? Because the HIV attacks the immune system, it destroys your body's ability to fight infections. Once patients develop full-blown AIDS, their lifespan is usually shortened. Often, AIDS sufferers get an opportunistic infection or an infection that happens only in the people whose immune systems are not working very well. Others get some kind of cancer, such as lymphoma, cancer of the lymph nodes, or sarcoma, a cancer of the skin. How are HIV and AIDS treated? The time that passes from when a person is infected with a disease and when he or she actually gets sick is called the incubation period. In AIDS, the incubation period can be over 10 years. The only treatment available for AIDS is a combination of several drugs and is called the combination therapy. These drugs slow the reproduction of the HIV virus and lengthens the incubation periods of HIV. A second type of treatment is usually needed for the AIDS patients who suffer from opportunistic infections. Unfortunately, these treatments only delay the progress of the disease, and most patients die from AIDS. In this slide, you'll see a picture of a virus that leads to AIDS, HIV. Here, you're just going to let you look at it, read a little bit, think about what's happening. AIDS, acquired immune deficiency syndrome. The main symptoms of age. Here's a picture. I'll let you read through them and check it out and see what some of the effects and symptoms are.